Okay, we are back and we are getting into cognitive behavioral coaching. Cognitive behavioral coaching is a theory that says that your thoughts are what create your emotions, your behaviors, and even your physiological condition. And so the idea is that if you can change your way of thinking, you can change your thoughts, behaviors, and feeling and physiological state, which is essentially what your body does that is outside of your control. So sweating, trembling, sinking feeling in your stomach, all those types of things, nauseous, those are physiological responses. Okay. And I should say from the outset that some people find this message somewhat invalidating. The objection will be that, you're saying that what happened to me isn't difficult, isn't challenging, isn't traumatic, that it's just my thinking about it. And that is not the message that we're trying to send. We're not trying to invalidate anyone's feelings. We're not saying that what happened to them isn't difficult, isn't painful, isn't traumatic, nothing like that. What we are saying is that while you can't control the things that happen to you sometimes, sometimes bad things happen to you and there's really nothing you can do to stop it, but you can control the way that you think about the things that happen to you. And you can change the way you respond to them, the way that you orient yourself to them. So this is kind of, glass half full, glass half empty, same objective reality, two different ways of looking at it, two different sets of responses to it. Other examples are things like, let's say that somebody is assaulted in some way. They can think, I'm a victim, which comes with a particular set of emotions, behaviors, and physiological responses. Or they can say to themselves, I'm a survivor, which comes with a different set of responses. And so the question is, which way of thinking serves you, serves your goals, helps you to live out your values, your beliefs? Okay? So again, same objective reality, different orientation to the reality, different result. All right? Another example, you're trying to learn something new. The thought is, I can't do this, or I can't do this yet. One little word, 3 letters, completely changes the way that you're oriented to the difficulty that you're in. Same objective reality, different orientation. Okay? So that is the sort of overview of cognitive behavioral theory. You are going to learn cognitive behavioral coaching. It's really the same as cognitive behavioral therapy in terms of the tools and the ways that you use them. It's just in your application. As in all things coaching, it's not that the tools that you're learning couldn't be applied to the past. It's just that that's not the realm of coaching. Coaching is present and future oriented. So we're going to take the coaching, the cognitive behavioral tools, and we're going to apply them to present and future oriented difficulties or challenges or adversity or goals or whatever it is. Okay. So in the next video, I will give you an overview of the different layers of thought in cognitive behavioral coaching and how they are related to a biblical worldview even. Once we have that, then I will teach you the various tools within cognitive behavioral coaching. First, understanding how to monitor your thought life, how to identify thoughts that are leading to problematic behaviors, emotions, and physiological conditions. And then we will learn to help clients modify their thoughts, not just their thoughts on those thoughts that just occur to you as life events are happening. You have thoughts. I mean, you have millions of thoughts a day. Okay, so that's the most accessible layer of thinking, I guess you could say. It's still somewhat subconscious, but you do have access to it if you really stop and think about what your thoughts are. And some people would say that's what cognitive behavioral coaching is teaching clients to learn to think about their thinking. Some people call it meta thinking. So you teach your client, here's how cognitions or thoughts are connected to behaviors, physiological states, and emotions. Here's how you can monitor your thoughts, and then here's how you can modify your thoughts in order to change those problematic emotions, behaviors, and physiological conditions. Okay? And of course, we will be practicing this along the way in your triads. So that's what you have looking forward to in this section of the training. So I will see you in the next video where we will get into understanding the different layers of thought. I mentioned those surface level thoughts or interpretations of life events as they happen. Then underneath those are intermediary beliefs, and underneath those are core beliefs. So we'll get into all of that in the next video, and I will see you there.